The dental hygienist is the preventive professional in the dental office. They're the person that is roughly the same as the registered nurse in the doctor's office. And so the dental hygienist does cleanings, x-rays, fluorides, sealants, educational, nutritional education, anything that has to do with preventing tooth decay or gum disease. That's what we do. We work in conjunction with dentists, and most of the time we work in private practice settings. However, dental hygienists can also work in schools. If the school has a dental clinic, we can work in the veterans hospitals, other types of hospitals, prisons, nursing homes. So anywhere there's people who need to have an exam and check, then we can work there. So and it's actually a really good job. I never planned to get into dental hygiene. About 40 years ago, a long time ago, I was studying to be an English teacher. And then I met this cute pre-dental student. And, you know, the rest is history. So I'm still married to him 38 years later, and he is the cutest dentist in the whole wide world. I'm a little prejudiced, but I kind of switched my plans. And so instead of teaching English to high school seniors who are bored to death, now I teach dental hygiene to our dental hygiene students. So it's really fun. We do have a dental hygiene clinic over in Building U, and you can all come and get your teeth cleaned there. As students at TSTC, it's only $10. So students, yeah, it's a really good deal. In private practice, if you get your x-rays or cleaning and your fluoride, it's about $150 to $200, depending on what kind of x-rays you have. So it's good. Do y'all have any questions you want to ask me? When you can, we have clinic on Tuesday and Thursday, and we do have evening hours. You just call and make an appointment. Okay. Any other questions? Let me tell you a little bit about the program. It is an associate degree program. It's extremely competitive. We take about 30 students, and there's about 150 people who apply every year to be one of those 30 people. And why do you think everybody wants to be a hygienist? It's so glamorous, right? Good pay, yeah, that's it. It's very rewarding. It is very, very good pay. We actually make more than registered nurses, and the nurses get kind of cranky about that because they have to work the midnight shifts. And why? Because there's not as many of us, I think. There has been a shortage, yeah. And so the Department of Labor estimates that through the year 2030 at least, there will be a shortage of hygienists and dental assistants. I'm also teaching the dental assisting program. And so there's jobs. Of our graduates that just graduated in May, everybody has a job. I'm going to share a little story with you. Here in the Valley, and you've probably heard this before, pay tends to be a little bit lower than if you go outside the Valley and go to San Antonio or Austin or Dallas or Houston. So when our students are getting ready to interview and go out into the job world, I said, don't settle for less than $25 an hour. I mean, just don't settle for less than $25 an hour. $25 an hour, right. I clean teeth. I take care of patients all day long. Yeah. So I tell one of my students, I said, so don't settle for less than 20, So she goes up to Houston and she's interviewing. And the office manager asks her what salary she expects. And she said, I'm thinking not less than 25. She goes, so I take a deep breath and I say, I want to make $27 an hour. And the lady looks at her. And she goes, what? She goes, we don't start anybody at less than $34 an hour. So, not too shabby. Now, it's an associate degree, but it's actually a 3-year program because there is a year of prerequisites. So you have to be THEA complete or AccuPlacer complete, and you've all taken, when do you take that, or have you taken it already? You'll be getting it? Okay, so you want to make sure you pass all 3 parts of that. Once you've passed your AccuPlacer, you have to take Anatomy and Physiology 1 and General Chemistry, and then there's a test in January called the TEAS test. And this is the test of essential academic skills. Depending on your score on that test, that's how we decide who gets in. So like I said, there's 150 people. Now, in our classes, we have people all the way from Canada. And again, people come all the way from Canada. At least a fourth of my class every year is from Canada. And Canada hygienists make a lot more money, and our program is so good that the word is spread, and we have people from Canada. We have people from Houston, Dallas, because like nursing. Yes, sir.
Ma'am, if you're like studying for that, right?
Mm-hmm.
Between the 3 years, you can start working for that.
You work in the clinic, you can't get paid. Dental hygienists are like doctors or dentists. They have to be licensed. So even when you graduate, you still can't go out into practice. You have to pass a clinical board where you have to take patients to a dental school. You have to pass a written national board. So once you graduate, you pass both your boards and apply for a license, then you're licensed.
How long will those two after you graduate? How long will that take?
Usually, they take their national board, their written board in March, and their clinical board right after they graduate. So usually by June they're working. So it's pretty good. So it's pretty cool. And I have to brag a little bit. Many dental hygiene programs, and this is why we have so many students, one of the reasons we have so many students from Canada, many dental hygiene programs are 4-year bachelor degree programs. The national board is the same that we have to take, whether you're an associate degree program, which is a 2.5, 3-year program, or a 4-year program. Our students, we consistently range at 97 to 100% pass rate the first time. We are right now doing better than UT Houston, UT San Antonio with their 4-year program. So you don't have to leave the Valley to get a really good education. The great part about dental hygiene, well, there's lots of great parts about it, is patient care. I really like, if you like 2 things you have to do. You have to like people, okay, because a lot of people don't want to come see us. It's hard to believe. We're nice people, but a lot of people are scared of us. Not nearly as much of the hygienist as of the dentist. My husband got real tired